Our program is one of the oldest and largest in the country. Really what I like the most about it is our curriculum. We prepare our residents to do full spectrum family medicine. Medicine's changing and residents choose sometimes one track or another, but it's a lot of fun to teach residents how to be good, comprehensive doctors, and I think we do that very well.
Our mission is centered around creating comprehensive, trained family medicine physicians who can work in the different kind of communities in rural and urban, suburban, and can participate in leadership positions in the community as well. We also have 7 fellowships, so a lot of our residents stay and do extra training for 1 year. The fellowships we have family medicine, sports medicine, family medicine OB, emergency medicine, hospital medicine, pediatrics, and behavioral science. That speaks to the trainings they receive really here in the program and how they feel confident about going out and doing different aspects of practice.
Well, we're very fortunate being a university-based residency because we have a lot of resources that a community-based residency would not have. What I tell the residents is the only limitation are the hours in a day because they have a very busy curriculum.
I came here 10 years ago. I walked around, and one of the things that really stood out was not everything was siloed off. People talked to people, they knew each other. And I was really surprised because I'd never been in that environment, especially we're a pretty big place, right? So that's really hard to do.
Residents here are involved in every aspect of patient care and taking care of patients as well as the hospital as well as in the office. The graduates that leave here feel very comfortable dealing with all sorts of different types of procedures or emergencies or even patients that come into their office later on. They're well equipped to take care of all sorts of different patients from all sorts of different backgrounds in every different environment.
I feel like when I leave here, I'm going to have all the knowledge, all the skills to practice whatever medicine I choose, whether that's outpatient, inpatient, a mix of both. I feel like I'm going to be well prepared. I also love the faculty that you can kind of find who you gel with, who you mesh with.
I think the program has prepared me. I've gotten kind of really expert training throughout the whole gamut of residency where I can do anything and everything when I get done.
Going through residency here, you're exposed to, the hospital setting and the clinic setting. If I have a patient, I can take care of their medical needs, but if I need social services, they're right there. And it's just good just having the support here.
We have faculty that are interested in sports medicine, geriatrics. We also have faculty members who practice traditional full spectrum family medicine. I think it's really unique that each of our incoming interns can kind of help identify what their future career goals are, and we can kind of help shape them into that position as a faculty member.
You have 16 people per class. So you have a family of 48 people here, all different walks of life. Having 47 other co-residents with you is one of the things that will drive anyone to come to this program. When your goal is to be the best physician you can be at the end of 3 years, this is the kind of program that you look for.
We have a medical librarian on campus who can help you bolster your research, do a literature review on a subject that you're trying to study.
You have a lot of resources here, so if you come here, take advantage of those resources, work with the different attendings in their various specialties, and take everything away from the experience that you can. Because once you're finished with residency and you're looking at what you're doing in the real world, you want to be able to take those experiences with you so that you feel prepared to take care of patients wherever you may end up.
I think the amount of hands-on opportunities that we have here to work with patients, it's a pretty unique opportunity to be able to see your patients both in the inpatient setting and outpatient setting so frequently.
You are especially here surrounded by people who are ready to jump in and help you. You always have your classmates, you always have upper levels, and you always have attendings that are just one phone call away, if not already here in the hospital.
We have a great wellness committee to help facilitate activities for the residents to do. Bowling, we've done paintball in the past, we do movie time, we have cookouts, we go to a pool party every year. Quite a few activities that are available to us.
The future of family medicine is bright. I think we have changes going on in reimbursement that are going to support family physicians to a greater extent in the future. We're finding ways to create more access with patients via telemedicine, extended hours, and more patient portal interactions. We're going to continue to produce high-quality, comprehensive family medicine physicians and provide excellent care to their community.
My absolute favorite thing is watching somebody start at the beginning of a training program and watching them grow along the way, and then when they go off and they've, achieved the next level, it's something that's absolutely fantastic. What I'm doing is going to impact people long after I'm not here anymore, long after I've retired.
You come to our residency, you're going to be supported not just in research, but you're going to be supported in your clinical endeavors, taking your in-training exams. We all work very, very hard to make them successful. And if we identify something that they need, we make sure that they get it. It's a fabulous program. It's a hard program, but when they leave here, they're outstanding physicians, both in the inpatient and the outpatient setting.
I think the sky's limitless here just because there's so much need in this area. And thankfully, we have the physicians, the attendings, and the support system to be able to, uphold the goals that we look forward to achieving.
Join us and become part of a tradition of excellence where legends are made.